This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you've joined us today. And today we want to talk about pain, and specifically in your back and in your neck. We're delighted we've got with us Dr. Shawn Marcucci, who is the Chief Medical Officer at Baylor Scott & White Medical Center in Plano. Welcome to the show.
Well, thank you for having me.
You know, for our listeners, pain can be on a different scale. It can be kind of a moderate pain or severe, and it really can complicate other healthcare issues. Can you talk a little bit about pain in the back and the neck?
Sure, absolutely. You know, it's one of the most common reasons people seek care, medical care, and especially in our emergency departments. And it can be anywhere from, simple pain that comes and goes very quickly within a matter of 1 to 2 days to, debilitating back pain that results from, a herniated disc in your back or other complications.
Sometimes it's acute, it can become severe and almost debilitating. Is there specific expertise that you can share with our listeners related to what they need to do?
Sure, and that's kind of why we developed our back and neck center, was to help patients navigate that, because it can be a very complex problem for patients. And sometimes we, even as care providers, aren't sure of the exact care that patients need. And so we've developed our program to help guide patients through care. We've assembled a multidisciplinary care team to help guide patients and navigate them through their care.
So let me ask you this. Let's assume someone's watching that football game. It goes into overtime. They fall asleep on the couch. They're kind of cramped. And when they get up, they've got back pain and neck pain. How would you describe that? And what should you do when you experience that?
Well, for simple pain, right? So if someone's having difficulty walking or standing up, or has numbness and can't feel their legs, or have problems going to the bathroom, those are signs of an acute problem that don't resolve in a matter of, a couple of minutes or a few minutes. Those kind of things are urgent issues that patients should go to the emergency room for. Most back pain, the vast majority of back pain, is self-limiting, resolves on its own with simple care at home, either heat or warm packs, heating pads, cold packs, whatever is more comfortable for patients, and over-the-counter medicines like acetaminophen or ibuprofen. Generally, for the vast majority of patients, back pain resolves on its own in less than a week or two.
You mentioned a good thing there, a week or two. Let's say after about 10 days, you're still experiencing, I won't say severe, but maybe acute pain. At that point, you should see a medical professional, I would think. Can you elaborate? Absolutely.
Best word of advice for patients is to see their primary care doctor for further workup that needs to be done. And generally, that's usually in the form of x-rays to make sure that there's no acute urgent problem going on. And then primary care doctors can get them in the pathway to take care of what may become something that needs even more intensive therapy and care. And that's kind of what we've developed our back and neck center to help primary care doctors and help patients navigate through.
To help our listeners a little bit, let's assume they are out working in the yard. They kind of overdo it. They come in and they're really tired. Their back is tired. They feel a little pain. So they take a hot shower. They apply some heat. You mentioned cold packs. Should you alternate, or can you just do heat or just do cold?
You can do either that makes you feel comfortable, I will say. The best thing for an acute injury or acute pain is probably cold packs. That will reduce inflammation and swelling in the short term and in the acute phase. And then as things are getting better and healing, then more heat will help promote blood circulation and blood flow to the area and help promote healing.
I guess from a layman's point of view, I've heard people say this, and I have a stiff back. My back's kind of stiff. I have to get going, and it stays with them. Is that something they should seek medical professional help if it continues?
So sure, anything that's lasting long term probably needs to be evaluated by a medical professional. And that could be what you hear of as sciatica or, a pinched nerve. It could be spinal stenosis where the opening of your spinal canal is narrowing. It could be as simple as muscle stiffness and tight ligaments and joints. And any of those things could lead to a variety of needs for intervention. And that's where I think patients tend to struggle, is they just don't know where they need to go next and what level of care do they need. And that's what our programs help to design to help patients navigate through.
You mentioned in your answer a couple of things that really are intriguing about, if you have a sciatic nerve issue or a muscle issue. But let's assume potentially you could have a vertebrae issue. How does a patient distinguish where their problem is, or how do you as a physician eliminate muscle, nerve, or bone?
Right. And so that's a combination of seeing your provider or seeing a care provider, conducting a physical exam or a thorough history and evaluation. And usually those things will require initial imaging, whether it's with a regular X-ray, progressing up to maybe a CT scan and or an MRI, to really get detailed images of both skin, soft tissue and bone in your spine to see to pinpoint the problem and where it's occurring.
As you treat patients in your back and neck pain navigation program, do sometimes you finally say, we're going to have to perform surgery?
Well, sure. That's the beauty of our program, right? Is when patients have pain that's not resolving on its own and don't know where to go. We have a multidisciplinary team of specialists and nurse navigators and advanced practice providers that help the patient along every step of the way. So, we help the patients whether they have already had imaging or we get the right imaging based on their history and symptoms for them, and then we navigate them to the right and appropriate care level that they need. And that can be anywhere from physical therapy to our pain management specialists. We have behavioral health clinicians. And then at the point where their surgical intervention may need to be evaluated, we have spine surgeons that we refer patients to get them to the appropriate level of care to be evaluated by a surgeon. The main focus of our program is to get patients quickly through the program, navigated to the appropriate level of care they need to get their pain resolved as quickly as possible.
Boy, if you've ever had sudden onset of back or neck pain or an automobile accident, you know how important this topic is. More right after the break with Dr. John Marcucci from Baylor Scott & White Medical Center in Plano.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're continuing this conversation with Dr. John Marcucci, who is the Chief Medical Officer from Baylor Scott & White Medical Center of Plano, talking about one of the main reasons that people go see a doctor, back and neck pain. Steve?
I am curious, in your program, do you have many athletes, that are in contact sports that might have some type of back or neck injury?
So we can certainly manage them as well. We also have a second opinion program too. So if patients feel like they've seen a doctor that's recommending surgery or recommending interventions, and they'd like our surgeons to give a second opinion, we also have that service available through our program as well. The program's still new, so I don't have specifics of breakdown of whether we're seeing sports injuries, chronic back pain. I can tell you anecdotally that we're seeing a lot of patients that have chronic back pain that's progressed or been unable to be managed by their primary care physicians. And so we're seeing a lot of referrals from our primary care offices.
How do you think thus far the patient's perspective has been about this program?
We're getting great feedback from our patients. We are following them all along the way. We're managing them through the program. So we're not just a referral program. We're actually managing these patients through the process. So if pain management isn't working, we collaborate with our pain management doctors to say, this person's, really probably needs to see a surgeon, and back and forth. And so we're also navigating them through physical therapy and rehab. And if they need to see a behavioral health specialist, then we're referring them into them to help manage their pain. So we're guiding them through the process. We're checking in with them throughout the process, making sure that things are getting better and we're on the right path with them. So we're getting great feedback, because most of the time when patients have back pain, like we talked about earlier, they don't know where to go. They don't know if they've got back pain that needs to see a surgeon, and they don't know if they need physical therapy. And so we're here to help them navigate that process based on their symptoms to get them the appropriate care at the appropriate time. And we don't want, right? Nobody wants to have surgery. And so we're trying to, when patients do need surgery, they need to get to a surgeon. So we're also trying to help navigate the process to make sure that we're getting the patients that actually need to see a surgeon to see a surgeon. And we're doing things quickly. We have participation agreements with all our providers that we're able to see these patients quickly in all aspects of our program and get them the care that they need.
That's what I was interested about. This program is new. It seems like that you have really become almost the gatekeeper, if you will, to help people that have neck or back pain. But how do people have this journey start? Do they have to get referred by their primary care physician? Can they contact you directly? What is the way the patient starts the journey?
So that's a great question. And our vision at Baylor Scott & White is empowering you to live well. And so our mission is to get patients the care that they need and the way that they want the care. And so we have opportunities for patients to be referred into the program through any avenue the patient wants to come into our program, or their doctor. So we'll take patients from our primary care providers. They can get a referral from their physician into our program. If patients, and as we talked about earlier, a lot of patients end up showing up in our emergency departments. So our emergency department physicians can refer patients into our program if they feel the need. And then also we have a website and a referral number that patients can refer themselves. If they feel like they just want to come into our program, we have a website available for them to come into our program, or they can call our referral number themselves, and that's 469-814-BACK, and they can call our program and be evaluated by one of our nurse navigators.
If someone experiences an injury, let's assume they're in an automobile accident and they do have neck injuries or back injuries. If they enter your program and you get them through the initial treatment they need, do you also have relationships where they can have ongoing rehabilitation as they hopefully recover from this and re-enter the lifestyle they had previously?
Sure. Actually, we have a relationship with our Baylor Institute for Rehabilitation, and we can navigate patients for, physical medicine and rehabilitation, physical therapy, and those services are absolutely a part of our program.
So what would you say has been the overall response thus far, and are you pleased with that response on this program?
Oh, absolutely. In the first 3 weeks, we had over 100 referrals into the program. Over 50% of those patients are being currently navigated through the program. We're probably in I believe, our second month right now, and we're well over 200 referrals into the program. We've had patients that have already been through and had successful surgeries. Like I said, the overall response has been great. We're hearing from our primary care physicians as well, who are, sometimes get stuck trying to manage patients with chronic back pain, back and neck pain. And we've been a lifeline to them as well. And so it's been really helpful, and that's been our goal.
To our listeners, do you have any final thoughts, not only about this program, but about back and neck pain in general?
Sure. Back and neck pain it can be debilitating for patients, especially when it's ongoing and chronic. And we're here to help. We're here to help navigate you through. We're trying to be the easy button, and our goal is to help people and make care better and empower patients to live well.
This has been Dr. John Marcucci, who is the Chief Medical Officer at Baylor Scott & White Medical Center in Plano. If you would like to know more about the program, simply talk to your Baylor provider about the program and ask them if you might be a candidate. Also, Dr. Marcucci's interview is on our podcast and our YouTube channel under the Human Side of Healthcare. Now, we're going to take a minute to get an update from Steve about some of the latest trends of illnesses and hospitalizations across North Texas.
Thomas, we're detecting a slight uptick in COVID-19 here in North Texas, and also this new XBB 1.5 variant is becoming prevalent in Texas. So we want to caution everyone, let's be careful, practice good health habits. We still have almost 200 people in the hospital with the flu, and so that's over and above COVID. And we would like to speak with Dr. Shawn Riley from Medical City CareNow about his thoughts related to viruses and specifically the flu here in North Texas.
We monitor for the flu here in North Texas. We look at a bigger picture. We look at not what's just happening here in our own neck of the woods, so to speak, in the Dallas-Fort Worth Metroplex, but we take a look at what's happening around the nation and around the world as well. The CDC flu surveillance, which runs about 2 weeks behind, has noted a national uptick, with Texas reporting a particularly high influenza-like illnesses. But a little more recent and specific data from the Texas Department of Health and Human Services notes there's been about a 30% increase week after week of positive flu tests in Texas and here in Dallas.
I was talking to an emergency room doctor, and he told me, things are changing. He said, Steve, I've been treating patients with flu in June, July, August. He said it's been all over the board. It just hasn't been that traditional flu season. Would you say that's what you're seeing? And what is the traditional flu season?
Yeah, absolutely. It has been a little bit different this year. Usually we see the flu season in the United States start up in about November, generally peaks in about January or February, and kind of peters out around March or April. And although flu seasons can be notoriously difficult to predict, we generally look to the southern hemisphere to kind of know what might be happening to us in the future, because once again, their winter is our summer. When we take a look at Australia, for example, their flu season started particularly early, which was early to mid-October. Once again, about 6 weeks earlier than what we would normally see, and we're starting to mirror that here as well.
When someone presents with symptoms, how do you differentiate if it's COVID-19 or the flu?
Both of them are going to have a patient coming in with a fever and a cough. Now, it could just be another disease as well. It's not just the COVID and the flu that are out there during the cold and flu season, but we have things called rhinoviruses, enteroviruses, and particularly in children, RSV, or respiratory syncytial virus.
That's Dr. Shawn Riley, who is the Regional Medical Director at CareNow Urgent Care across North Texas, and the RSV has been particularly aggressive again this year as well. Now, when we come back, we're going to talk about a skin issue that can also be correlated to a mental health issue. Find out what it is next on the Human Side of Healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. We're delighted you're with us today. And today we want to talk about some skin conditions, especially psoriasis. And we couldn't have a better individual than Dr. James Ralston, who's a board-certified dermatologist at Medical City McKinney, and also he has in his private practice the Dermatology Center of McKinney. Dr. Ralston, welcome to the show.
Thank you. Thank you for having me on it.
You know, many of our listeners, I'm sure, have seen commercials on TV for different types of medications for psoriasis. But to really set the stage, could you tell us what is psoriasis and how common is it?
Yeah, psoriasis is a very interesting condition. It's a chronic inflammatory disease, and part of the immune system becomes overactive and speeds up the skin cell growth. So normally your skin cells grow and shed or fall off in about a month. But with psoriasis, the skin cells do this in only 3 or 4 days. So instead of shedding, the skin cells pile up on the surface of the skin, causing a rash. And so patients with psoriasis often have these scaly plaques that can happen anywhere on the body, most commonly on the elbows, knees, scalp. And then also that inflammation can affect other organs and tissues in the body. So, for example, 1 in 3 patients with psoriasis can also develop psoriatic arthritis, where they can have swelling or stiffness and pain in the joints. It's a very common condition, psoriasis is. Symptoms usually start between ages 15 and 25, but can really happen in any age. It can happen in men, women, children, all skin types, and it affects more than 3% of the U.S. population. U.S. adult population right now. So that's more than 7.5 million adults in the United States.
Yeah, that's amazing. 7.5 million adults. You know, you mentioned it was chronic. So once you have a diagnosis, and I know there's treatment, but can you outgrow it?
So it just depends. Like many autoimmune or immune-mediated conditions, there's not a definitive cure for it. However, there are really good treatments. Over the last few decades, we've seen major advances in our understanding of what causes psoriasis, and which has led to the development of some amazing treatments. Many of those, you see on the commercials that you referenced. It really depends. Sometimes psoriasis can go away if it's being triggered by something. Sometimes there's a medication that can be causing the psoriasis, and in cases like that, we see it clear up. But for most people, it's a condition that that we can clear up with these medications often. But it's one that can keep coming and going. However, I don't think it's unreasonable to believe that a potential cure is on the horizon because of these tremendous advances we've been observing in the last few years. But the wide variety of treatments that are now available and new options that are available, it's not a condition you have to just you have to suffer from.
You mentioned 3% of the population is impacted. Does it tend to be hereditary?
That's a very good question. We know that the immune system and genetics play major roles in its development. So, and the genetics of it's very complex. We do see it run in families sometimes, but it is possible to develop psoriasis even if you have no family history of the disease. A lot of times we see a triggering event that can cause a change in the immune system, which can bring on the onset of psoriasis symptoms. There's a lot of just everyday things that can trigger psoriasis, causing it to appear for the first time. Things like stress or a skin injury, such as a bad sunburn or a cut, infection, such as strep throat. Certain medications I mentioned can trigger it. Weather changes, especially cold, dry weather, tobacco, or excessive alcohol.
You mentioned in your answer strep throat. So strep throat could actually trigger psoriasis?
It can. In fact, there's a subtype of psoriasis called guttate psoriasis, and that primarily affects young adults and children. And that's usually triggered by a bacterial infection such as strep throat. And the rash for guttate psoriasis looks like small drop-like scaly spots on the trunks and the chest, back, arms, or legs, or all the above.
Yeah, you mentioned that you see all kinds of skin disorders. What would you say are telltale symptoms that might make you think you have psoriasis?
Yeah, so the most common type of psoriasis, called plaque psoriasis, typically we see these dry, itchy, raised plaques covered with scale. They can be different colors. Classically we call them silvery scale, but it doesn't have to be that color. Most commonly occurs on the elbows, knees, the lower back, the scalp. Sometimes we see it in the fingernails. Sometimes you can have something called inverse psoriasis, where it occurs in the body folds, such as the groin area. And then there's more rare types, such as pustular psoriasis, which has pus-filled blisters. So fortunately, that's rare. And then the least common type is called erythrodermic psoriasis, and that can cover the entire body with a peeling rash that either itches or burns. I think the main thing is that psoriasis can, it varies widely on how it looks from person to person. Some people have just a couple spots. Some people have dandruff-like scaling in their scalp, and then other people have, major eruptions over a large percentage of their body.
Let's assume that a child at school developed psoriasis, and I know you said generally age 15 to 25, but is it contagious? Could it spread throughout the classroom?
That's a very good question. Psoriasis is not contagious at all. So you cannot get psoriasis from another person. So I think that's an important thing for people to understand is that psoriasis is not contagious, and there's no reason to be, afraid of patients with psoriasis or have any concerns about catching psoriasis from the individual that has psoriasis. And I think that's important for people to know, because I think it's stressful enough for these patients who have psoriasis. I don't want them to, people to worry about, having to avoid them.
You mentioned the different parts, the elbows, the knees, and even in the scalp area. How would you differentiate psoriasis from dandruff?
Well, that's a very good question. My first recommendation is if someone thinks they may have psoriasis, it's a great idea to see a board certified dermatologist, to confirm that. What we look for in the office is sometimes we can see, subtle differences in how the rash appears. Other times there can even be an overlap. There's something called sebopsoriasis, where something like dandruff or seborrheic dermatitis can overlap with psoriasis. So sometimes you can have two different things going on, if it looks like dandruff in your scalp. So I think, anything that makes you think you might have it is worth getting checked, just because there are such good treatments, especially if it's not clearing up with, regular over-the-counter dandruff treatments.
You mentioned for psoriasis, there are many forms of treatment, which is certainly good. What would you say, by and large, would be the main treatment that is used?
That's a great question, too. So it really depends on how extensive the psoriasis is. The good news is that, about 80% of people with psoriasis have mild to moderate disease. And the other good thing is that there's good treatments, no matter how severe it is, whether you have mild, moderate, or severe psoriasis. Things that you can do to treat if it's very mild, if there's just a few small areas on the skin, then there's topical steroids or non-steroidal topical medications. So we use those a lot, and there are some some topical medicines that have just recently been approved that we're seeing great results with. So, I think that's an important message too, is that, if you've been treated, if someone's been treated with psoriasis in the past and haven't had a visit for a while, there have been so many new treatments recently that it's worth taking a look at and, getting checked out and just having a discussion, to see if there is a better treatment for the patient to be on, because there are so many new ones. So mild treatments mild psoriasis we can usually treat topically. If it's more extensive, or if it involves the joints or bothersome in other ways, then you can do phototherapy, which is light treatments. There are oral medications that alter they calm down that increased immune response. And then there are a variety of injectable medicines called biologics. A lot of the ads we see on TV are for these biologics. And, it's really amazing to me, just in the time that I've been in practice, treatments for psoriasis have gone so far that, most patients can be cleared up with it. Even patients with severe disease can get so clear that it's hard to find where they have a rash on their skin.
This is Dr. James Ralston, who is a dermatologist at Medical City McKinney. When we come back, fasten your seatbelts. We're going to talk about a correlation between psoriasis, our skin in general, and mental health that is going to really surprise you. Next on the human side of healthcare.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're going to continue this conversation about psoriasis and the largest organ of our body, our skin, with Dr. James Ralston from Medical City McKinney and the Dermatology Center of McKinney.
You mentioned the importance of seeing a dermatologist, and I know we're talking about psoriasis, but if you have a malignant melanoma, you need to get immediate attention. But you said something in one of your earlier answers. If you have psoriasis that goes untreated, it could impact your joints and even have a form of arthritis. Can you elaborate on that?
Yes. Psoriatic arthritis, that inflammation that occurs from the overactive immune response. Some people even have it just in the joints without a rash. Other patients, who have a rash of psoriasis develop joint involvement. And I think that's very important for people to know, because, I've seen many people where they come to me for the first time with psoriasis on their skin, and I'll ask them specifically if they have any joint pains, and it's common where they say, "Oh, well, yeah, I have arthritis, but why?" And I explain to them, well, that arthritis could be related to the psoriasis, and a lot of these systemic treatments we have, either pills or the biologic injections, can not only treat that psoriatic arthritis, but it can also help to avoid permanent joint damage. So that's one thing about psoriatic arthritis is we have medications to stop that progression, or at least slow it, where if you're getting treatment early, you can really help to avoid permanent joint damage, and that can have a big impact. So, so if you have a rash and you have joint pains, definitely you want to get checked out and get on a good treatment.
What would you like to share with our listeners related to psoriasis that we have not touched on?
Well, I think, in addition to these medication treatments, I think it's also important to have a healthy lifestyle. You can actually treat psoriasis with things such as weight loss, a healthy diet, exercise, not smoking, decreasing alcohol, decreasing things that cause stress or anxiety. Typically, when we treat psoriasis, we use these great medications that are now available, but also, talk about lifestyle modifications. Another thing I'd like to mention is, we talked about, how psoriasis can impact, other aspects of your body, such as the joint involvement. We also see some patients with psoriasis have an increased risk of heart disease or obesity or diabetes or lymphoma, that sort of thing. But then also, what I think is really important to mention is that depression in patients with psoriasis. There's a study that says it may be higher than 50%, and I think that's a very important thing to recognize, is that psoriasis can have a substantial psychological, emotional impact on people. And so, that's why I want to get the word out that there are really good treatments, and patients who are suffering with this condition, please do get help, because there are great treatments available. And and every year there's more coming. I go to dermatology conferences all the time, and it's exciting to see the things that are here now, and the treatments that are coming. And go see a board certified dermatologist, and it can really have a big impact on your life.
Dr. Ralston, this is Thomas. I've just got a follow up on that. The skin is our largest organ. When you talk about depression being manifest on our skin, now that's an interesting comment. I don't have a question. It's just an interesting observation.
Right. Yeah. And I think that, of course, I'm a big fan of treating the skin. But, skin is that's what people see. When you meet someone for the first time, they see your face, and, they see your hand, and so I think the skin does have, is very closely tied to our emotional health. And, and then the other thing is too, sometimes the skin is kind of a window of what's going on the inside. If things aren't healthy on the inside, sometimes that shows on the skin. And that's one thing that I really like about what I do is I can help with, the largest organ on your body, and help not just fix the skin, but sometimes treating the skin or observing changes in the skin can make a big difference for your health on the inside as well.
Yeah, this is really interesting, and I know we have a fairly narrow topic here for this segment today, but as a dermatologist, would you, if we were talking to you casually at a restaurant or out in a social event or something and talking about your business, and it came to this about the fact that our skin reflects our inner health as well, our mental health, and mental health being such a prominent issue today. Do you see this in other areas of dermatology as well, besides just psoriasis?
Yes, I do. And yes, and I think that's a big part of dermatology is, again, not only fixing what's on the surface, but also, recognizing changes in the skin that are a sign of something going on the inside, or just helping people, feel better about themselves. A lot of times if we improve the skin, it can help you feel better. This is a little off topic, but I was at a dermatology lecture one time that they talked about the prevalence of skin conditions in villains in movies, like especially children's stories, so like a witch with a big wart on her nose, or a villain with a big scar, or some other skin issue like that. And and number one, it doesn't mean it is a villain if they've got some skin condition. That's an important thing, to note. But I think it is interesting that, when someone, has made a cartoon or something in the past that, you'll see skin conditions reflected in that. And, so I think it is a very important thing to treat.
Steve, I'm kind of blown away here.
Yeah.
Between you and me, we've got about 100 and gazillion years between us. I've never correlated that our skin would be a reflection like that of our mental health.
Yeah, I never have either, but it makes logical sense. And I can understand certain skin conditions could cause you to be depressed. It affects, as he just said, the physical appearance. I can see how it's tied in.
That's amazing.
I was going to say, this is, not talking about psoriasis, but one of my favorite things with my job is treating teenagers with acne. And I've seen where young people come into my office and, and they feel self-conscious and they're worried about how their face looks, and then we get them on treatment and get them cleared up, and then they come back and usually they've got their hair cut, out of their face, and they've got a big smile on their face, and it can really make a difference in how they perceive themselves. And, I think it is very important.
What an incredible surprise, if you will, at least for those of us who have not studied it like Dr. Ralston has. We've been talking with Dr. James Ralston. He's a board-certified dermatologist at Medical City McKinney, and also his private practice, the Dermatology Center of McKinney. Steve?
Thanks, Thomas. Great advice today. We want to thank our listeners, and we hope you'll join us next week for the human side of healthcare.